1. When designing a radiology training program for adult learners preparing for FRCR examinations, which principles should guide the curriculum structure? A. Focus exclusively on memorization of imaging findings without clinical context. B. Connect radiological concepts to learners' existing clinical experiences and case-based scenarios. C. Deliver all content through passive lecture-based instruction only. D. Avoid hands-on image interpretation until after written examinations. 2. Which evaluation method is most effective for assessing a trainee's competency in image interpretation for FRCR Part 2A? A. Written essay about radiological techniques. B. Rapid image interpretation with timed responses and pattern recognition assessment. C. Self-assessment questionnaire without objective verification. D. Attendance tracking at radiology conferences. 3. In FRCR curriculum development, what is the primary purpose of analyzing Royal College examination blueprints? A. To eliminate practical training components. B. To align training content with actual examination structure, weighting, and required competencies. C. To reduce program costs by focusing only on basic topics. To avoid teaching anatomy and pathology integration. 4. According to adult learning principles, radiology trainees learn image interpretation most effectively when A. They passively observe consultant reports without active participation. B. They can immediately apply pattern recognition skills to real clinical cases with feedback. C. All teaching occurs through textbook reading without image review. D. They memorize differential diagnoses without understanding pathophysiology. 5. Which communication technique is most effective when providing feedback on a trainee's misdiagnosis? A. Public criticism during departmental meetings to motivate improvement. B. Specific discussion of the imaging findings with systematic approach to correct interpretation. C. Vague comments like, "You need to look more carefully." D. Delayed feedback weeks after the case without clinical follow-up. 6. What regulatory compliance requirement must radiology departments typically adhere to regarding radiation safety? A. Radiation safety regulations can be ignored during training. B. Compliance with ALARA principles, dose optimization, and regulatory body requirements. C. Only consultants need to understand radiation protection. D. Trainees are exempt from radiation safety protocols. 7. When mentoring a radiology trainee struggling with FRCR anatomy preparation, which approach is most effective? A. Providing all answers immediately without encouraging problem solving. B. Using systematic questioning to help identify anatomical structures and relationships. C. Avoiding any guidance to promote complete independence. D. Criticizing their knowledge gaps without constructive teaching. 8. In FRCR Part 2A examination, which question type best assesses higher-order diagnostic reasoning skills? A. Simple recall of terminology definitions. B. Complex cases requiring differential diagnosis formulation and key feature identification. C. True-false questions about equipment specifications. D. Multiple choice questions with obviously incorrect distractors. 9. What is the primary purpose of formative assessment during FRCR preparation? A. To assign final pass-fail grades only. B. To provide ongoing feedback, identifying knowledge gaps, and guiding focused study. C. To rank trainees competitively against peers. D. To replace all practice examinations. 10. Which adult learning principle suggests FRCR training should emphasize clinical correlation? A. Adults prefer abstract theory without practical application. B. Adults are motivated by immediate relevance to clinical practice and patient care. C. Adults learn best through passive observation only. D. Adults should avoid collaborative learning with peers. 11. When developing FRCR preparation curriculum, which element ensures examination relevance? A. Input from recent FRCR candidates and Royal College syllabus alignment. B. Focusing only on outdated examination formats. C. Eliminating all practice with actual examination-style questions. D. Avoiding discussion of examination technique and time management. 12. What communication strategy works best when teaching radiological interpretation to diverse learners? A. Using complex medical terminology without defining terms. B. Presenting information only through written reports without images. C. Adapting explanations using systematic search patterns and multiple teaching modalities. D. Assuming all trainees have identical baseline knowledge. 13. Which mentoring technique builds confidence in radiology trainees preparing for FRCR? A. Comparing trainees unfavorably to previous high-achieving candidates. B. Providing progressive complexity in cases with positive reinforcement for improvement. C. Overwhelming trainees with rare diagnoses before mastering common pathology. D. Focusing only on weaknesses without acknowledging progress. 14. In FRCR Part 1 examination, what is the purpose of testing anatomy in radiological context? To make examinations unnecessarily difficult. B. To assess ability to apply anatomical knowledge to imaging interpretation and procedures. C. To test only memorization of anatomical terms. To avoid evaluating practical radiological skills. 15. Which evaluation method provides comprehensive assessment of FRCR Part 2B oral competencies? A. Written multiple choice examination only. B. Structured oral examination with image interpretation, viva, and rapid reporting components. C. Peer popularity assessment. D. Self-declaration of competency without verification. 16. What characterizes effective learning objectives in FRCR preparation courses? A. Vague statements about understanding radiology. B. Measurable outcomes like identify key features of common pathologies on chest radiographs. C. Objectives focused on instructor demonstrations rather than learner performance. D. Outcomes that cannot be assessed objectively. 17. When teaching radiological reporting for FRCR Part 2B, which practice is essential? A. Ignoring structured reporting frameworks. B. Teaching systematic approach to image interpretation and clear communication of findings. C. Encouraging vague descriptions without specific measurements. D. Avoiding discussion of clinical relevance and management implications. 18. Which principle recognizes that adult radiology learners bring valuable experience? A. Treat all trainees as having no relevant clinical knowledge. B. Leverage trainees' clinical experiences to contextualize radiological findings. C. Disregard any prior medical training or patient encounters. D. Avoid connecting imaging to clinical decision-making. 19. What is the advantage of rapid reporting sessions in FRCR Part 2A preparation? A. They are easier to organize than other teaching methods. B. They simulate examination conditions and develop pattern recognition under time pressure. C. They require no preparation or feedback. D. They eliminate the need for systematic image review. 20. Which communication skill is critical when presenting cases in FRCR Part 2B oral examination? A. Using hesitant and uncertain language. B. Clear, structured presentation of findings with logical differential diagnoses. C. Avoiding all technical terminology. D. Speaking rapidly without systematic approach. 21. What is recommended for providing feedback during FRCR preparation? A. Annual feedback only after examination attempts. B. Regular formative feedback with specific guidance on interpretation skills and knowledge gaps. C. Waiting for trainees to fail examinations before offering help. D. Generic encouragement without specific technical guidance. 22. When developing FRCR assessment criteria, what ensures fairness and validity? A. Keeping assessment standards secret from trainees. B. Using clear criteria aligned with Royal College examination standards and syllabus. C. Changing standards arbitrarily for different candidates. D. Basing assessments on subjective preferences. 23. Which instructional strategy effectively teaches emergency radiology for FRCR? A. Textbook reading about emergencies without image review. B. Case-based teaching with urgent findings, identification, and management implications. C. Theoretical lectures without clinical context. D. Avoiding discussion of critical findings, communication. 24. What is the purpose of continuing professional development after FRCR qualification? A. To generate revenue for educational providers only. B. To maintain current knowledge of evolving imaging techniques, guidelines, and evidence. C. To punish newly qualified radiologists. D. To create unnecessary career barriers. 25. In radiology mentoring, which behavior demonstrates active listening? A. Interrupting with diagnoses before reviewing the complete study. Paraphrasing the trainee's interpretation and asking clarifying questions about findings. C. Multitasking during case discussions. D. Providing answers without understanding the trainee's reasoning. 26. Which curriculum development model ensures FRCR preparation stays current? A. Static curriculum never updated after creation. B. Cyclical model incorporating Royal College updates, examination feedback, and evolving evidence. C. Random approach without systematic planning. D. Model ignoring all examination syllabus changes. 27. What makes a distractor incorrect answer effective in FRCR-style questions? A. Being obviously wrong to ease examination difficulty. B. Representing plausible differential diagnoses or common interpretation errors. C. Having no relationship to the clinical scenario. D. Using nonsensical medical terminology.